This video will demonstrate how to prepare your facility for a patient monitor and how to perform an incoming inspection on a patient monitor when it arrives at your healthcare facility. Incoming inspection ensures a new patient monitor is safe and ready to use on patients. It involves ensuring all components ordered are correct, visually inspecting the patient monitor, confirming its safety and function are acceptable, documenting device data, and communicating with clinical staff the need for user maintenance and other key points. Acceptance testing is typically done by clinical or biomedical technicians, technologists, or engineers, but may be done by another technical or clinical professional at your healthcare facility if they have the right competencies. The patient monitor is used to measure physiological vital signs, display this data, and alarm when the values are outside alarm settings. 3 levels of patient monitors have been classified. A basic patient monitor measures non-invasive blood pressure, pulse rate, and oxygen saturation. An intermediate patient monitor measures ECG, non-invasive blood pressure, oxygen saturation, respiratory rate, heart rate, and temperature. An advanced patient monitor measures ECG, non-invasive blood pressure, oxygen saturation, respiratory rate, heart rate, temperature, CO2, and invasive blood pressure. Before your new patient monitor arrives, it is important to confirm that the clinical space it will be used in is ready for it. Several aspects of the clinical space will need to be examined. Determine if the device will be mounted permanently in the clinical ward. Make arrangements with the proper party to install permanent mounting for the device which meets the needs of clinical staff, is within 1.5 meters of an appropriate electrical outlet, is safely installed to meet the weight and usage requirements of the device, and has proper communications connections should a central station or computer connection be required. If the device will be used as a portable unit, determine if it will be used on a cart or a pole to be wheeled around to the patient location. If it will be wheeled around, ensure that the cart or pole is stable and that attachment is secure. Handheld devices should be located in a central, clean area in the unit. If the device is portable and contains a rechargeable battery, it should be stored in a location with outlets for electrical charging when deployed. If you experience frequent power fluctuations, consider using a voltage stabilizer to regulate the power to the patient monitor. If you experience frequent power cuts, consider using an uninterruptible power supply or UPS of appropriate capacity to provide the patient monitor with consistent power. Before you start acceptance testing, prepare your workspace. You may be working in an engineering workshop or somewhere else in your facility. Prepare your workspace by cleaning the work area, laying out your tools, and test equipment that you will be using, such as any and all patient monitor accessories, such as cables, transducers, sensors, and others, digital voltmeter, pressure measurement and generating device, calibration gas for carbon dioxide monitor, thermometer and bath, and general biomedical engineering toolkit. If available, a multi-parameter simulator and electrical safety tester are also valuable test devices. Make sure you document the acceptance testing results in the database system you use at your healthcare facility to record device information, dates, schedules, and other data. If you don't use a database system, document the testing results on a checklist or paper record and file it with the patient monitor record. Now you are ready to unpack the patient monitor and any other boxes that came along with it. The boxes may have been opened already by someone at your facility who received the shipment just to verify the contents. Make sure your hands are clean by soaping and washing. Follow your facility or national guidelines and protocols regarding donning and doffing of appropriate personal protective equipment. For a global reference, visit the WHO website or enroll in an open WHO course on infection prevention and control. Open up the box containing the patient monitor carefully. Open up the other boxes from the order and check the contents against the packing slip and the purchase order. For patient monitors, cables, probes, and transducer accessories, along with sample consumables, will be included. The items included will be based on the parameters monitored. Ensure that the power cable matches the electrical connection in the clinical area where the device will be used. Make sure both the user manual and the service manual are included in the box. Some vendors provide the manuals on CD or online. Verify that the documentation is accessible. Read through the user and service manuals provided with the patient monitor to familiarize yourself with them. Note any discrepancies or any damage to the device or accessories that may have happened during shipping and report it right away to the supplier and your colleagues who need to know, such as the purchasing or stores manager, as well as the care provider. Now you are ready to inspect the condition of the patient monitor. Examine the outside of the patient monitor. The visual inspection should evaluate the condition of external hardware such as knobs, display screens, and handles. The device should be clean. Remove any shipping-related protection materials such as screen protectors. Now you are ready to turn the patient monitor on and check its basic functions. Review the user manual for device operation instructions. Also, review the service manual to determine if there are specific function checks for the model you have which differ from your generic device inspection form. Always follow the manual when it conflicts with the generic instructions. Plug the patient monitor into a power outlet and turn it on. If the device has a self-test function, ensure that all tests are passed. For devices that have supplemental battery power operation, this function should also be checked when operated with this power source. The device will often come with the battery not charged and will need to be plugged in and charged to full capacity per the manufacturer's recommendations. Test the electrical safety of the patient monitor. Electrical safety testing should be the first performance test. It is covered in a separate video, Electrical Safety Testing. Now you are ready to test the performance of the patient monitor and confirm it is within specifications. Note: additional detail on performance testing is found in the video Step 6, Preventative Maintenance, Patient Monitor. Review the manuals for performance testing for the model you have and always follow the manual when it conflicts with generic instructions used by your organization. Basic patient monitors measure two parameters: non-invasive blood pressure and blood oxygen saturation via pulse oximetry. Tests for non-invasive blood pressure include static pressure accuracy, leak tests, high-pressure relief valve verification, and, if specialized test equipment is available, dynamic pressure accuracy. The device may have to be put in service mode to make these measurements. Pulse oximetry testing verifies the accuracy of the oxygen saturation measurements and the pulse rate. Specialized test equipment can simulate a variety of oxygen saturation levels and pulse rates. If the specialized test equipment is not available, it may be necessary to test the unit on yourself. If this is done, note your pulse rate manually during the test and compare it against the monitor reading. Intermediate patient monitors typically include ECG, respiratory rate, and temperature, in addition to non-invasive blood pressure and pulse oximetry. ECG monitor testing requires an ECG simulator to test heart rate, voltage amplitude, and recorder or display speed accuracy. If an ECG simulator is not available, apply ECG electrodes to yourself per the user manual and observe the ECG rate versus your pulse and waveform clarity. Respiratory rate is typically measured using the ECG leads in a technique known as impedance pneumography. The multi-parameter patient simulator would be used to verify respiratory rate accuracy, waveforms, and gain. Again, if a simulator is not available, follow the user manual to connect the device to yourself and observe the respiratory rate versus your breathing rate along with waveform clarity. Temperature accuracy should be verified against a calibrated temperature device in a solution which is the range of body temperature. 2-point temperature calibration is preferred. Advanced patient monitors have all the parameters of intermediate level monitors, plus carbon dioxide and invasive blood pressure. To test the carbon dioxide monitor, a gas solution with a precise concentration of carbon dioxide must be used. Verify the user calibration function works correctly and the flow pump in the sampling circuit is functional for sampling type carbon dioxide monitors. Invasive blood pressure monitors require testing of the static pressure accuracy and, if specialized test equipment is available, dynamic pressure accuracy. Now you are ready to test the alarms on the patient monitor. Review the manual for how to test the alarms and always follow the manual when it conflicts with these instructions. Not all alarm conditions can be simulated easily. Specific alarms will be included for all clinical parameters, and technical alarms will occur for patient monitor equipment or accessory problems. For all parameters in patient monitors, there will be high and low alarms based on the values measured. These can be tested on yourself or with the multi-parameter simulator, temperature bath, pressure generating device, or carbon dioxide gas mixture. For all alarms, the audible level should be adjustable and be loud enough for the user to hear in the patient environment where it will be placed. Visual alarms should be visible at distances where the user is typically located in the room. These items should be verified when the device is installed in the healthcare facility. You've now completed acceptance testing on your new patient monitor. If the device did not pass the acceptance test, double-check the failed section of the test. If verified, the vendor should be contacted directly or through your administrative process. If the device passes, apply the unique device identifier label or asset tag to the device. If other labels are required, such as battery replacement date or warranty end date, apply these labels as well. Be sure to record the work in the patient monitor database computer or paper file. The unique device identifier, device type, manufacturer, model, serial number, and department location are essential, with other important data, to record being placed in service date, end of warranty date, device cost, maintenance provider, and preventative maintenance schedule. You will need the performance testing results in particular to refer back to when you are doing maintenance on the patient monitor in the future. One final thing you should do is review the routine care and user maintenance procedures for the patient monitor with the clinical care providers who will be performing these tasks when the patient monitor is in use. These tasks will help extend the life of the patient monitor. Watch the Using the Patient Monitor video in this series to review the care provider's routine care and maintenance procedures for the patient monitor. This video is not meant to supplant professional judgment and the need to seek the advice of clinical or biomedical specialists, particularly for discussion and evaluation of complex cases. World Health Organization expressly disclaims responsibility and shall have no liability for any damages, loss, injury, or liability whatsoever suffered as a result of your reliance on the information contained in this video. World Health Organization does not endorse specifically any device, company, test, guideline, treatment, or procedure mentioned in this video.